Our critical appraisal is on the effects of oxytocin on withdrawal, craving, and stress response in heroin-dependent patients, a randomized, double-blind clinical trial by Moini et al., published in 2019.
It tests to see if acute administration of intranasal oxytocin is more effective than placebo in reducing symptoms of withdrawal, craving, anxiety, and stress hormone levels in male heroin-dependent individuals.
I like how it's a randomized, double-blind, placebo-controlled clinical trial. This will hopefully limit sources of bias. What did you guys think of how the population was selected?
It was nice that the population was randomized using a computer-generated random number with the aid of a blinded staff member at the clinic.
Yeah, I agree. But it's too bad that the population was limited to only male participants. I would have liked to have seen more diversity in sex, ethnic background, socioeconomic status, and also age. The study took place in Iran, which is a different population than we have here in Canada, so it may not be applicable here.
Good point. They also were not able to find enough female heroin-dependent patients from the recruitment clinic. However, the 58 participants that they did study were randomly put into two groups, and there was no baseline differences between the groups in terms of education and marital status.
The only inclusion criteria were that the patients had to meet the definition in the DSM-4 for heroin dependence, and the exclusion criteria were patients that had other medical issues or who were dependent on or using any other mind-altering substances.
DSM-4? Are they stuck in the 1990s? The DSM-5 came out in 2013.
Good point. Thanks for that, Laura. So those that were included were randomly placed into either the intervention group, who received 40 IU of intranasal oxytocin, or the control group, who received intranasal placebo saline spray.
Both groups were shown pictures of heroin-related stimuli like lighters and people smoking. Craving levels, withdrawal symptoms, anxiety, and cortisol levels were measured before and after the administration of nasal sprays.
I feel like they were able to adequately monitor their craving levels too. They participated in the opioid withdrawal scale, visual analog scale, and a Hamilton checklist. They also had their cortisol levels checked.
The tests did show decreased craving scores and reduction of withdrawal symptoms, but there was no differences in anxiety scores between the two groups.
The intervention group had lower cortisol levels too. Too blessed to be stressed, I guess, can't relate. But most of those tests are subjective, not quantitative. Anyways, so how valid are the results?
It's interesting how they can have lower cortisol levels, but their anxiety didn't decrease.
True, and these scores came from the questionnaires they filled out half an hour and an hour after being shown the crave-inducing stimuli. So it's hard to tell whether the beneficial effects will be long-lasting.
What were some overall strengths you guys noticed?
Good question, Laura. Obviously, the study was well designed with good use of blinding and randomization. It seems like there was high internal validity and the study was accurately measuring what they set out to measure. This question is also highly relevant in light of the current opioid crisis in Canada. Do you guys think there were any negative aspects?
Well, I noticed some spelling errors in the published study. For example, they go back and forth between using heroin spelled correctly and heroin with an E at the end. That's a female superhero. What would you guys like to see different in the next study on this topic?
Larger and more diverse sample size would have been nice. We need female representation.
I would have liked to see a longer time frame because it would have been interesting to see whether decreased cravings can be sustained over the long term. What would an ongoing oxytocin treatment regimen look like in real life would be an interesting aspect as well.
So, what's the bottom line here?
This trial has a positive outcome. It shows that there is a benefit in using 40 international units of oxytocin intranasally to lessen the experience of withdrawal and cravings in heroin addicts.